Today we are doing some upper lip line filler and doing a little bit of plumping for our patients' really cute lips. Sometimes people get lip lines from smoking, from puckering, or just even, sucking on straws. So they can be really annoying to people. But luckily, we have got hyaluronic acid fillers that we can help those lines with. So I've already numbed the sides of my patient's mouth right here, and we're going to use something called the cannula. It's a blunt tip, so that way I'm just going to go underneath her skin, so it will lay nicely across the lines. Sometimes when you use a needle and you go up into each individual line, it will make you look ducky, and what I always say here is we don't want to duck you up, so I know I'm funny. Okay, anyway, okay, so we already have some numbing happening. Can you feel here?
Mm-mm.
Okay, good. Here we go. Beautiful. All right, so I'm going to go in through my little port that I just made with my cannula, and I'm just going to glide through your skin. I know it feels so good. Here we are. You can see my cannula right there. And we're just going to do a little bit on this side here. Is this the side you sleep on?
I'm gonna sit on my back.
Oh, good job. Yeah, excellent. So this has got some lidocaine in it, so your lip will feel nummy soon.
Okay.
I should say your upper lip.
Mm-hmm.
And let's put a little bit actually into, are you doing okay?
Mm-hmm.
And as I'm gliding through your skin, I say gliding loosely, I am also irritating your cells. So they go into fight or flight mode. Since the cells in there can't go anywhere, they fight back by making more collagen. So just by using the cannula, you are going to make collagen, which is a nice treat. Yeah, that looks nice. The other nice thing about cannula is that I can just keep going back and forth in my little port right here, so I don't need to poke you 3,000 times to do lip filler or upper lip line filler, which is a bonus. A lot of people are afraid of lip filler because they think that it's going to hurt, and it does kind of hurt when you use a needle, but we've got really good numbing cream. But this is usually the way that I like to do lips, especially for lip lines, because it just lays so much nicer. Okay, so we're going to go down. I want to put a little bit more. I'm going to put a little bit in your bottom. So I know, weird. I know you love me right now. Loving me, loving you. Okay, there we go. I don't know. Is there a song? Let's go here. And give you a little bit more cuteness for the lower lip, which we enjoy. Usually if the normal distribution or proportion for upper to lower lip is if your upper lip is considered a 1.0, your lower lip should be a 1.6. So it needs to be a little bit juicier just naturally. All right, we're going to go to the other side. Can you feel here?
Mm-mm.
That's a very good answer. I like that answer a lot.
Mm-hmm.
Okay, so you do just a tiny bit up on this upper lip lines. And there are certain fillers that we like to use for lips. So there's no reason for a patient to know which ones. I mean, it gets confusing as a patient, but if you just were to go into your provider and tell them this is what I want done, then they should be able to figure out what lip filler would be the most appropriate, or what filler would be most appropriate for that location. So it would kind of be silly for me to do what belongs in your cheeks and your lips, because that would be too hard. And it would be silly for me to do what belongs in your lips and your cheeks, because that would be too soft. So there's different properties of fillers. And as long as you're going to a provider that knows, you'll be fine. The great news, I don't know if I told you this, I don't know if I told either of you two this, but there's over 26,000 offices in the United States that do injectables, and we are in the top 10 in the country. Isn't that cool?
Mm-hmm.
Yeah, I think that's awesome too.
So did it go to the middle? Because I couldn't feel.
perfect.
You know?
That's perfect. I did go to the middle of your bottom lip,
Okay.
and I did the upper parts of
Mhm.
your upper lip.
Mhm.
So, I mean, that's pretty much lip filler. So, I don't think it hurt. I mean, it didn't hurt me. Did it hurt you? No. Okay, good. So, and lip filler can last you for up to a year. It really depends on which lip filler you use. But if you want to find out more about lip filler, like you can see my cute lips. I just did them a week ago. Anyway, we'll post my before and afters. But if you want to find out more about lip filler or about any of the other procedures we do at Rejuvenation MD, you can find us on Instagram, Facebook, YouTube, and online at RejuvenationMD, medspa.com.